Hello ladies and gentlemen, this is Dr. Haris, a graduate of dental surgery from Lahore, and this video is also concerned with a topic of anatomy, which is the tongue. Now the tongue is a muscular organ. It is covered by a mucous membrane and it is divided into an apex, a body, and a root. The nerve supply of the tongue is very complex and it is also very important. We know that the tongue is responsible for carrying the sensation of taste. Therefore, the tongue has a general sensory supply, which is responsible for touch, pressure, pain, and temperature. And it also has a special sensory supply, which is concerned with the taste. Now we'll start with the general sensory supply. We divide the tongue into thirds. We have an anterior 2/3, a posterior 1/3, and a posterior most region. The anterior 2/3 of the tongue is supplied by the lingual nerve, which is a branch of the mandibular nerve, and whenever we give an inferior alveolar nerve block, this nerve is anesthetized. We give this block when we are extracting any tooth of the lower arch or any other surgical procedure which concerns the lower arch. The posterior 1/3 of the tongue is supplied by the glossopharyngeal nerve, which is the 9th cranial nerve, and the posterior most region is supplied by the vagus nerve through its internal laryngeal branch. Now we'll talk about the special sensory supply of the tongue. Now the taste sensation, which is carried from the anterior 2/3 of the tongue, is carried by the chorda tympani nerve, which is a branch of the 7th cranial nerve, the facial nerve. In the posterior 1/3 region, the glossopharyngeal nerve carries the taste sensation as well as the general sensation, and similarly in the posterior most region, the vagus nerve is responsible for carrying the sensation of taste as well as the general sensations. Now there are 4 basic tastes: sweet taste, salty taste, sour and bitter taste. The sweetness is tasted at the apex, in the apex region of the tongue. The salty taste is at the lateral margins of the tongue. And the sour and the bitter tastes are tasted in the posterior most region of the tongue. Now we'll talk about the motor supply and the muscles of the tongue. The tongue has 4 intrinsic and 4 extrinsic muscles. We'll only talk about the extrinsic muscles. The first extrinsic muscle of the tongue is the genioglossus muscle. This muscle originates from the mandible and inserts into the tongue. It is supplied by the hypoglossal nerve, which is the 12th cranial nerve, and the action of this muscle is to protrude the tongue. The second muscle is the styloglossus muscle. This muscle originates from the styloid process of the temporal bone and it inserts into the tongue. This is also supplied by the hypoglossal nerve and its action is to retrude the tongue. The third muscle is the hypoglossous muscle. The hypoglossous muscle originates from the hyoid bone and inserts into the tongue. It is supplied by the hypoglossal nerve and its action is to depress the tongue. Now the last muscle is the palatoglossus muscle. This muscle originates from the soft palate, from the palatine aponeurosis, and inserts on the tongue. This muscle is not supplied by the hypoglossal nerve. This muscle is supplied by the vagus nerve. Okay, and the action of this muscle is to elevate the tongue. Now all of the muscles of the tongue, whether they are intrinsic or extrinsic, are supplied by the hypoglossal nerve except the palatoglossus muscle. This table gives a very easy and a very good summary of all the nerve supplies which are concerning the tongue. It is very important for the students, so have a look at it. Moving forward, we'll talk about the lymphatic drainage of the tongue. Now, like we discussed before, the tongue has an apex, and the region of the apex is drained by the submental lymph nodes. The lateral halves of the tongue are drained by the submandibular lymph nodes. The medial region of the tongue is drained by the inferior deep cervical lymph nodes, and the posterior region of the tongue is drained by a combination of superior deep cervical lymph nodes and the retropharyngeal lymph nodes. So we've talked about the tongue. Now let's move forward to the clinical aspects of the tongue. First of all, let's talk about the gag reflex. Now, whenever we touch a posterior region of the tongue, we immediately appreciate the gag reflex coming into action. Now, this reflex is brought upon by the 9th and the 10th cranial nerves, which are the glossopharyngeal and the vagus nerves respectively. And this reflex is especially problematic to the dentists whenever they are taking impressions. So you have to educate the patient before you take an impression about the gag reflex and how you control it. Secondly, we'll talk about the importance of the genioglossus muscle. Like we said before, that the genioglossus muscle protrudes the tongue and keeps the tongue in its proper place. Whenever the patient is subjected to a general anesthesia, the genioglossus muscle falls back, and when it falls back, it blocks the airway. And it is a very dangerous condition whenever the airway is blocked. So, when we give general anesthesia to the patient, we also have to pass an endotracheal tube, like it is shown in this picture. Now, we'll talk about the nerve, that is the 12th cranial nerve, and any injury to the hypoglossal nerve. Whenever the hypoglossal nerve is injured, especially during a fracture of the mandible, we can appreciate it clinically whenever we ask the patient to protrude the tongue. When the patient will protrude the tongue will deviate to the affected side, the side where the hypoglossal nerve is injured. Lastly, we'll talk about a condition which is known as a tongue tie or a tied tongue. This is a congenital deformity, and what happens is that there is very small lingual frenum, and the result is that there is restrictive movement of the tongue. And the patient, especially this is common in the children, is in discomfort, and this has to be relieved by surgery. So this was all about the tongue. I hope you enjoyed this video. This is Dr. Haris. Thank you very much.